Matt Kaufax talked with DHEC today and with some local doctors. So, Matt, what did they tell you?
Yeah, guys, well, doctors I spoke with today tell me that those high numbers that you just mentioned, coupled with a high spread and positivity rate that we have here in South Carolina, mean you should be overly cautious, if anything. They also tell me that despite the dedicated poll workers who took extreme and amazing precautions during this election cycle, the relentless nature of COVID-19 still is not going away. Dr. Soria Sicosio with Prisma Health says one of the most pivotal days for democracy also came at a pivotal time for the pandemic.
We're at a time where we're experiencing the greatest surge out of the three peaks that we've noticed so far with our COVID-19 data.
She says hazards that a day like Election Day can present mean you should consider a COVID-19 screening.
The particular situation we've had over the last several weeks with elections and voting and standing in lines and seeing some crowds gather, perhaps not always being able to maintain 6 feet distance.
She also says watch parties, some without masks, can play a large role in spread.
A significant number of cases are spread according to those who do not have symptoms.
Even if you were being cautious or don't feel sick, she says being around lots of people you wouldn't ordinarily interact with for a long time is a factor.
We've had individuals who have stood in line for hours, and it is easy to drop your guard, bunch up in certain areas in light of the cold weather as well.
In a statement, DHEC says they've already been pushing routine screening for weeks and that you should use their guidelines for possible Election Day exposure. They and Sicosio also add this isn't just limited to November 3rd.
Costume parties, trick-or-treating has fallen at the same time as the polling places. And in a few weeks, we'll have Thanksgiving.
She says it's easier than it's ever been to get a test, and you could just save a life in the process.
Perhaps it's time for us to consider differently how we think about the opportune time to be screened.
And another incredibly important thing to note, especially if you can pinpoint a particular event or instance, whether it was on Election Day or just in general sometime in the recent past where you think you may have been exposed, doctors like Sicosio say that the conventional wisdom and that the widely accepted thing is that you should wait 5 to 7 days from that particular instance to get tested. That is because that is how long it takes COVID-19 to appear. Anytime before then, you could get a false negative. In Greenville tonight, Matt Kaufax, Fox Carolina, the 10 o'clock news.